Good afternoon, everyone, and thank you for joining us for Ask Dr. Lisa, a program we hope to bring you on a regular basis here. I'm Arlene Sweeting, part of the management team at WSLR and Folkdyville, and I'm joined by Dr. Lisa Merritt. Good afternoon, Dr. Merritt. Are you out there? Can you hear me?
Yes, I can hear you. Can you hear me?
I've got you now. We are
okay.
having a little bit of problem, just for those of you that may be tuning in, a little bit of problem. We're hoping that it doesn't impair the discussion too much in terms of the internet feed that Dr. Lisa is getting. But just to give you a little background, Dr. Merritt obtained her medical degree from Howard University after completing undergraduate studies at Georgetown University with honors. She underwent training in family and community medicine at the University of California at San Francisco, and completed residency in physical medicine and rehabilitation at the Baylor College of Medicine in Houston, Texas. In 1995, she founded and remains the executive director of the nonprofit Multicultural Health Institute, which works to address racial and ethnic health inequities and to recruit and mentor future health leaders. And the focus of today's conversation will be COVID-19, and we welcome your questions and comments in the live chat. So if you have any questions that you'd like to get answered, I'm sure Dr. Lisa will be able to help. So I will be monitoring that, and we'll let her know if they come in. But Dr. Lisa, we were going to start, the country is starting to reopen back up now after a couple months of varying degrees of lockdown, depending what state you're in. And I know that you have been doing some traveling lately, and I wondered if you could share what you've been seeing and what some of your concerns are right now.
Okay, well, yeah, it's been an interesting couple of months for all of us. And as an essential worker in the health field, I've had the privilege and the challenge of traveling throughout the pandemic through all parts of the country. And I would have to say, traveling over Memorial Day weekend, as things are starting to concern, I'm actually more concerned for myself personally having to travel now than at the height of the pandemic. Because at the height of the pandemic, it was eerie psychologically, but it was so empty. Entire airports, all the stores shuttered, there were no people. The security checks, I'd often be the only one or maybe one or two other people going through. The planes were virtually empty. We often had our own entire
We are losing your audio, Dr. Lisa. So that the stream might not be strong enough where you are to continue with this broadcast. But what we will do is I will give the folks out there some local information. You're still frozen. And we can try this again when Dr. Lisa has a better internet signal. We'll give you, yeah, you're still on, but we're not hearing you. You're frozen. So just to let folks know where some testing is available here in Sarasota County, I'm going to scroll some information along the bottom of the screen. So if you live in Venice, there is testing available this week on Wednesday and Thursday at the Venice Community Center. Now, this is being run by the Florida Department of Health here in Sarasota County, and you do need an appointment. This is for people that are experiencing symptoms of COVID-19, and that's going to be from 8 a.m. to noon at the Venice Community Center at 326 Nokomis Avenue South. If you are farther north here in Sarasota, there is also testing available at the Robert L. Taylor Community Center at 1845 34th Street. And that testing is daily from 9 a.m. to 6 p.m. through May 31st, and no appointments are necessary to be tested at that location. So Dr. Lisa's back. We're going to try it again. All right. Can we hear you, Dr. Lisa?
Yeah, can you hear me? Sorry about that. Did you lose me?
We lost you. I do have you now. I don't know how long we'll have you, but you can share some more information with us.
Yeah, so
about.
I think what's interesting is early on in the pandemic, everyone was very rigorous. And as healthcare providers, we, of course, were extremely rigorous in understanding the proper precautions. Everyone had their masks. I actually would double mask to protect my N95 mask and get it to last longer. And washing of hands and avoiding touching things, cleaning the areas where you sit, etc. A lot of spacing and social distancing. And the planes and the airports were virtually empty. All the shops were shuttered except for maybe one shop. There was no service, no water, no snacks given on the planes, etc. Now that things are opening up, you're seeing more people starting to come into the airports, not fully adhering to the recommended guidelines for distancing, wearing their masks consistently. They sort of have to do it when they get on the plane. But other than that, masks are hanging off of the edge of people's ears. That seems to be the new style. I don't know if it's close to your face. Do you think it's actually helping? Because it's not. And we're all in a closed airspace with a lot of people. And many of the shops have not opened again. So there's not as many places for people to sit. So I find myself standing in a hallway, trying to find a safe space to wait for the next plane. A lot of people congregating close together and not really understanding the science behind the rationale, more resenting the rules themselves. And again, the lack of discipline of Americans is our downfall in terms of the opportunities that we've had to prevent this from spreading as much as it has. I can only hope that people will maintain that discipline and that patience as we move into the summer, because we are not through with this pandemic. We need to continue taking the precautions. The airlines are now able to protect their workers better with the airline attendants wearing masks. They sit at either end of the plane. They've blocked off a couple of rows to sort of protect them, but we're all in the same closed airspace.
Right.
And I've actually heard and been on flights with people sneezing and coughing, and they've taken off their mask in the plane. And it's like, well, that's very selfish, number one. And also, they put themselves at risk to inhale other things that may be going around. I've always worn masks. Just so I travel a lot, and people used to ridicule me. But from my days working abroad, internationally, et cetera, I've always been very aware of the risk of airborne disorders and to protect myself because I do travel and I don't want to have downtime. And I'm grateful that for me, so far, it seems to have worked well. I continue to test negative. I continue to practice universal precautions in my workspace, in my community space, in my family space. Part of my travels was to see about my daughter who is immunocompromised and who is having significant health challenges. And I did not stay with her. We had very limited, brief, socially distanced visits focused around her medical care. Yes, it was emotionally a little challenging, but it was for the best. And we both understood that. And it was for her mental peace of mind because she's at great risk. And the last thing I want to do is to bring something to her.
Right. I mean, this is a time where in our area and probably in other parts of the country, we are seeing actually increased testing because for a long time we weren't getting the testing that we needed. It wasn't available, right? But now
Right.
it is more available. And they do expect to actually see increased hospitalizations right now with the reopening of the country. And we see outbreaks taking off in other parts of the world too. I know Brazil right now is really
Right.
starting to boom, right? They actually, this morning, they're going to probably put a no travel order on from people leaving Brazil coming to this country. So we're definitely not out of the thick of things, even though there may be a tapering off over the summer. They are expecting a second wave in the fall, right?
And worst case with that is that, and understand Brazil and the Southern Hemisphere are on a reverse weather pattern from us. So they're going into their fall, into their winter, into flu season as well. And that's part of why it travels. And then as we go into our fall and into our flu season, we'll have the double whammy of flu and COVID. And that's what public health people and medical people are trying to say. Let's hold this down. Let's try to contain this. Let's try to eradicate, even if we could, and lower the numbers to allow us to regroup. I mean, this is an all-out marathon that everyone's been on. The doctors, the nurses, we're like, this is a lot. And I get really frustrated when I see people willingly putting themselves and their family, dragging a bunch of little kids through the airport with no protection, kids wiping themselves around on the floor, throwing stuff around, totally undisciplined. And then we have this inflammatory thing going on, and we don't know what is going to happen with children. Why you would want to put your children at risk like that, and
Right.
then expect us to just miraculously save them. I mean, of course, we're going to do everything we can for everybody always, but don't make it harder. Don't put yourself in the line of a train, you get hit by the train, and then you want us to put you back together again better than you were. I mean, it's just illogical. It really is.
So what do we know at this point about that disease that we see occurring in children, the multi-inflammatory syndrome disease?
Oh yeah, this thing is awful. We have about 160 cases in New York. Hundreds of cases now are cropping up in Europe, across the country. They put out we all got a national alert from the health services to be on the lookout for, when you have a new disease like this, then we all have to start being aware that this could be that. Something called Kawasaki syndrome or toxic shock syndrome, which have been previously recognized predominantly happening in Japanese American children, but that was named for the doctor. But it's a inflammatory disorder that affects the circulatory system. And so we know, as we're learning about COVID-19, which is a very weird, vicious, incredibly effective virus at impacting multiple organ systems. One organ system that we now realize it can even be a presenting symptom, not coughing, not sneezing, is cardiovascular. So that's your heart, the blood vessels that carry the blood from the heart. The thing can inflame the blood vessels. It can inflame the heart. It can, and they have yet to isolate it in the actual heart muscle, but it causes myocarditis, which is an inflammation of the heart muscle. And if the heart muscle is inflamed, it cannot pump properly, and you can have heart failure. And then also, it still can affect the lungs and cause respiratory problems and cause blood clots and other things. So you're having these children with these bright rashes. Their eyes are all bright red, injected without a drainage. If you think they have conjunctivitis or something, it's just their eyes are like bloodshot red, like a really bad hangover. Okay, that's all those microcapillaries being affected. They're having heart problems. They're having pain. They're having fatigue. And we don't know what's going on. It's quickly being studied again, but there's some cases they're able to identify the COVID-19 or presence of having had the COVID-19. And there's some correlation, and they're looking now for some type of underlying genetic susceptibility in some subpopulation of children, why it is that a formerly healthy child may somehow succumb to this thing in this way. And kids are always unique in the different ways that they can present. Some of them are having a rash, a bright red rash on their hands and throughout their body. We don't know, but I would say that if your child is running a super high fever, 102 degrees for several days, getting a rash, just not responding, not playing, you need to let the pediatrician know. They need to get tested. Everybody in the family needs to be tested. And that's what people need to think about when they make these decisions about wearing a mask or not wearing a mask, is who else they may convey this to. The person working in the store who then has 4 children they go home to, and one of those kids gets this, do you really want that on your conscience? Do you really not care about that? Do you really think only the strong should survive, which is what I'm hearing, this lingo and propaganda? I don't believe that about people. I believe the more it gets human, people can see the actual chain of events from their decision and behavior to the consequence on other people, that hopefully humanity will continue to prevail and not propaganda and misinformation that seems to be the order of the day to divide us. We're all in this together. We really are. And so, this thing with the children may be the thing that gets people's attention, because to me, there's nothing more sad and awful than a sick child fighting for its life over something that could have been preventable.
And so when we hear people talk about containing the disease, one of the things we hear about is contact tracing. Certainly,
right.
Collecting the data is important, and knowing what's happening in your geographic areas and the contact tracing. Talk to us a little bit more about that and how that works.
Yeah, that's like standard operating procedure. That's how Wuhan, they just finished retesting 11 million people because they're not having it again. They're like, whoops, we got a couple of cases. Boom, everybody gets tested. Anybody positive? Who were you with? Where do you work? Where do you live? Who's in your family? Contact tracing. Make sure to test those people, put everybody on quarantine, stop the virus from moving. That's what we did not do, and we are not doing. In fact, one of the questions that did come into MHI was, to what degree is contact tracing taking place in our area, and in particular in the 34234 zip code, which is a high level, and 34237 zip code, which both have higher numbers that were going into being a hotspot in our area, and also have high numbers of vulnerable populations, older people, people with chronic complex medical conditions, including cardiovascular diseases. Because this virus, part of how it affects the cardiovascular system, it links into something called the ACE2 receptor, which is on your blood vessel linings. So if you have high blood pressure and you have a higher expression of these receptors, the theory, we're still not sure how any of this actually works. Somehow it has greater avidity. In other words, it likes that more. And it's going to get a hold of those people faster and make them sicker because they often have underlying comorbidities of congestive heart failure. They may have had a stroke. They may have not had as efficient kidney function going. So they're already kind of weak. Jumps on them and it just can take them out faster and put them in the hospital sooner. So why are we not testing and tracing and focusing our efforts in those areas where we know we have the higher rates of stroke, heart attacks, cardiovascular diseases, respiratory diseases, like in the 34234, 34237, and other zip codes? I'm very happy to see the testing capability has now finally been opened up at Robert L. Taylor. I think it's a little too much it's later than I would have liked to have seen it, but I'm glad it's there. What I also want to know happens, like the UTC testing, which was again a great mobilization, but a debacle in terms of the delay in which people were informed of their outcome.
Right.
Because if somebody is positive, then you tell them they're positive. Like we have a great model in HIV work and hepatitis work. If there's a needle stick industry, or if there's been an exposure, or if somebody tests positive, you have a system where the health department has a DIS, disease investigation specialist, who interviews that person. Who have you had relations with? Who do you live with? Who do you work around? Who do you share needles with? Whatever their risk factors are and how they may have contracted the disease. It's totally anonymous. And then go out and contact those people. You may have been exposed. Can we test you? If you get these kind of symptoms, educational, what to look for, what to do. We need to be doing that with COVID. And that's part of why MHI is seeking resources and funding support to expand our capacity in terms of our community efforts. We've been on the ground from the beginning of this pandemic, building on the work we were already on the ground with regards to environmental health, respiratory health, health disparities, prevention, testing, and education. We did not have, like anybody, everybody lacked testing capability for COVID, although we do have that to some degree now. We worked on education and prevention, and we also resurrected our gatekeepers. Now we have the safekeepers of community health going through resilience, trauma-informed training in collaboration with Sarasota Strong, the Links, and several other organizations. And that includes people who are retired healthcare workers, nurses, CNAs, social workers, therapists, etc. And we're very grateful for that level of expertise. But we also know with our model, with the HIV/AIDS epidemic, that we train lay people in the disease process, the risks of transmission, the signs and symptoms of presentation, and what to do if somebody was sick with it or possibly coming down with it or became positive, how to get them linked to care and follow up, and to prevent further transmission through universal precautions, not sharing needles, using condoms, etc. So to me, this mixed message of, well, we're opening the country, just sit 6 feet away from somebody, everything's fine, makes as much sense as going through all of what we did with HIV/AIDS and then telling people, well, you can just look at certain people and tell whether or not they have AIDS, and you can decide whether or not you want to wear a condom and whether or not you might get, infected, protected sex. It's the same mindset to me, which doesn't make any sense at all. You want to treat everybody as a possibility, until proven otherwise. Get tested, know your status, keep getting tested, and practice, universal precautions in the meantime. And let's talk about why is that important. Again, this is a novel coronavirus. Novelty, new. Okay, nobody's immune system has seen this before until they get exposed to it and infected by it. So it's like the testing now that's going to be useful and interesting will be this antibody testing. That'll show your IgG, IgM, whether you have an acute phase reaction in your system or your immune system has just been challenged by this thing and it's responding to it, or whether it's a late phase reaction where your immune system was challenged with it, you fought it off, you have some circulating memory antibodies, but you're through the phase in which you may infect somebody else. And you have right now presumed immunity, although that's still, we don't know, but we're counting on being able to create that, which is the premise on which we're creating a vaccine. But let's talk about that. What does that mean? So it's like, I was thinking, when you you sign up for certain programs that you want to be a part of, and the first thing you have to do is on your computer, you have to create a password. Are you losing me? Am I still on?
You're still here.
Okay, good. Yeah, you have a password, you have to create an ID, you have to put in your information, where you live, your credit card, all your identifying information, and then boom, you can go in and use the program, the software, whatever. And the next time you want to use it, if you save it on your computer, it's like automatic sign-in, right? Easy, fast. So when your immune system encounters a new, previously unrecognized agent, it goes through that same process of understanding it, assigning it an identity, recognizing it as foreign, alerting the rest of the immune system, security forces. Okay, if you see this guy, knock him out. It's like antivirus software, right? Let's get rid of it. And so the next time it comes up, you already have circulating memories, and boom, we recognize that, knock him right off. He doesn't even get in. You can't get spammed or anything like that. So if somebody has exposure and has antibodies, they don't have to go, their immune system doesn't have to go through all that sign in, all of that verification. They already have a memory of it and they can knock that thing off. If somebody has never had that exposure, their body has to go through that process. Some people's bodies are stronger and faster and efficient, and 80% of people that are confronted with COVID-19 have minimal symptoms or none at all. But they could still shed and spread the virus. And that's why we need them to get tested too. And most of this testing data was based on prioritizing people with symptoms, and they could have had symptoms from a variety of things. And we missed the asymptomatic people during that time. We missed the opportunity to understand prevalence, like how many people really in the community are walking around with this thing, spreading it unknowingly, working, spreading it unknowingly, taking care of children, spreading it unknowingly, taking care of senior citizens, spreading it unknowingly. That's what we need. And then once we find those people, we have to find out who they congregate with, who they were hanging out. Now it's going to be going to the gym, going to the bar. It's going to be harder to track the context because everybody's getting out and about before we did that work that should have been done before we let everybody go out. This whole thing is happening kind of backwards. And it's also based on numbers. It's a theory based on numbers that were inadequate and incomplete because we didn't have enough testing. A significant percentage of the tests initially were false negatives. We missed people that way. We weren't testing widely enough across the population, and we weren't focusing on the most vulnerable people quickly enough. So it's a long answer to your question, but I know it's something that we want to, and what we want to encourage people is Johns Hopkins has a contact tracing protocol. But we can ask everybody to informally help us, help the health departments that are understaffed, that have to follow state guidelines that are often rigorous and rigid. And with the recent ouster of this woman who won amazing, Rebecca, what's her last name? Yes, the epidemiologist that, I know how she feels. She was a one-woman show. It's like we mounted this dashboard, our little dashboard and our response. And it took one person to decide to take the lead that had the capacity. She's a PhD. This woman didn't just make this up. And she did wrote the program, created the way to quickly share the data so all the rest of us could get it, use it, and inform our efforts. It was incredibly life-saving what she did. And then to turn around and have her, whether she's a woman, I don't know what the issue is, to be stigmatized, have her work stolen, which happens to women all the time. I'm really offended, and I'm very sad, because what she did was so helpful and so important, because she was trying to get the correct data. Without the correct, if somebody comes in and doesn't give me the right story, they hide the information. As a doctor, I can't fully help them. 80% or 90% of my ability to make a diagnosis is based on my conversation with the patient telling me what's wrong with them and their chief complaints and their review systems, and me knowing what questions to ask them, and then what tests to do and what to examine, etc. So data is the same thing with a public health emergency. If we don't have the right information, and then we're making decisions based on incorrect, insufficient, or inadequate or incomplete data, then we're not necessarily making the best decisions, and people are going to die. And that gets me to, we're cresting 100,000, nearly 100,000 deaths in the United States today from COVID. That front page of the New York Times, this reminds me of like the Vietnam War Memorial, which we far exceeded the number of deaths in Vietnam. I mean, this is untenable. There's only 300 and something thousand deaths worldwide. The United States has now made up almost a third of the deaths globally. People need to pay attention to this. That's a real number. That's not a made up, that's not propaganda. And that's actually not a fully real number, because we don't even have all the right numbers. The death medical examiner's reports has been suppressed. The causes of death we now are probably great. There's a lot of people who died alone, died at home, never got counted, never got tested. Heart attacks, strokes that are listed as such, but were they COVID provoked? There's a lot of other cases that we still don't know about. And I'm not here to promote fear. What I'm here to promote is responsibility. Knowing this information. Okay, I wasn't running around in a bubble. I'm going to just hide out and not do my work and not take care of people as a doctor because I'm scared. I took an oath. My job is to take care of people. My job is to use the proper known technology to protect myself and my team to the best of our ability, so we can take care of as many people as we can and not put ourselves at risk or compromise ourselves. So, by the grace, I'm doing okay. I'm doing this work and I'm helping people. But at the same time, knowing the numbers as they are, just because they're opening things and people can get out and about again, doesn't mean don't wear your mask. Doesn't mean stop washing your hands, especially when you go to the bathroom and also when you're getting ready to eat. Okay? I mean, just basic hygiene needs to persist. So I just feel really passionate, because I've lost colleagues. I've lost professors. This is real. I've talked to people who've literally come back from the dead repeatedly, bewildered, wondered how did they survive. I follow this from a professional standpoint because we all want to know as much as we can, as fast as we can, to use it to help people to the best of our abilities. But I also don't want to ignore the fact that the work of scientists and doctors, the CDC, is not being held as paramount in this country. And because of it, people are dying and suffering unnecessarily. You look at South Korea, China, Australia, New Zealand. You look at these places where they followed proper public health policy. They took care of their people. Their people are safe. Their people are doing better. They're opening it up.
Yeah. Well, one of the problems is we haven't had a coordinated national strategy. States have really been, kind of going it alone, and even local communities, like the effort led by the Multicultural Health Institute here in Sarasota. You can see scrolling at the bottom of the screen the website for the resilience platform that's being established locally, where people can go to get resources and information, and also to complete a needs assessment survey that you're trying to conduct, Dr. Lisa. So we are kind of reaching the end of our time for the half-hour show, but wanted to let you give out contact information, perhaps, if people are interested in getting involved or learn more about what you're doing here in Sarasota.
Well, certainly, I appreciate you running the dashboard. We really hope everybody will work on that dashboard and check the information while we can still get it as best we can for yourself. Just look at the numbers yourself. These are the numbers that we have to work with. Okay, And I would also say v-mhi.org. That's our website, that you can certainly go on that and link to the dashboard, link to the National Medical Association at nma.org, nmanet.org, because that is also a great resource. We've all been out there. We need to follow the guidelines, and we need to keep hope alive. The serum trials, the remdesivir, reducing the time in the ICU on ventilators by nearly a week. That's really encouraging and promising. The vaccine trials coming up, which they left over animal models and go into safety and efficacy. But the labs around the world are working together to help us. We do our part too, and together, united, we're stronger together. We can lift this thing. Everybody help with contact tracing. If you know somebody that's sick or been sick, encourage them to get tested. Encourage everybody in their family to get tested. Encourage them to quarantine, to stay isolated, and keep taking it serious. But most of all, know your own status. Get tested repeatedly if need be.
Great. Thank you, Dr. Lisa, for your time, and we'll look forward to talking to you again soon.
Thank you, Arlene. Have a great day.
Bye-bye.
Bye.